Hi, my name is Linda Barnes, and I am the director of the Master of Science program in Medical Anthropology at Boston University School of Medicine in the Division of Graduate Medical Sciences, and I'm very pleased to be talking with you about our program. And there we go. Sorry, this is early in my webinar career. So, first of all, the purpose of our program is to provide you with interdisciplinary training, and that's a very important piece. We recognize that anthropology itself has drawn on a lot of different disciplines, and we recognize that the kinds of research questions that students have when they come into the program requires incorporating not only background in anthropology, but in any number of other disciplines as well. Our goal is to help you synthesize the different disciplines that will help you best address your own questions and concerns in relation to your own career development. The program started in 2009 as a track within this division. It was a little unusual in that it's not one of the clinical sciences. The purpose was really to incorporate one of the social sciences that intersects with the field of biomedicine and to overlap with work being done here at the School of Medicine. So far, we've graduated about 50 students, and the average cohort size is between 5 and 10, although it is possible that we may go up as high as, say, 15 to a given cohort. But we're very committed to having small cohort sizes to enable a lot of one-on-one interaction between advisors and students, and to have small classes that are really about the size of a seminar. A lot of our students do the program as a terminal degree, and most have either gotten a job that is directly related to their training, or in some cases they go on to further training in doctoral level programs. But we take a lot of pride in the fact that many of them have gotten jobs within 3 to 5 months of graduating, and we see this as a direct result of the kind of training we try to provide. Now, what makes the program different from many others? First of all, it is one of the only programs based at a medical school. So it is the School of Medicine here that gives you your degree. Again, you can do it as a terminal degree or in preparation for other doctoral level training. You get training on the one hand in theories of medical anthropology, but also in research methods and design with a very applied focus. In other words, most of the people coming into the program are committed to applying their anthropology training to real problems in the world. We customize your program design so that on the one hand, you have the required seminars in theory and methods that everybody has to take, but then the electives are customized in relation to your own particular career goals so that you build areas of expertise that will help you develop in your career, but also will allow you to be better suited for your next steps. We have created a public health track within the program. We get questions from prospects asking whether it's possible to do a joint degree. That is not possible, but you can do a track in public health by taking several of our electives that are public health related skills in relation to social science training, such as epidemiology and program evaluation. You can also take courses in other colleges at the university in program management, or you could take several of your electives at the School of Public Health. It just allows you to acquire a background that you can synthesize with your medical anthropology background. We have a very community-based participatory research focus. Students in some cases do their field site placements and their service learning internship in clinical contexts, and that is a possibility. They also do them in the context of community organizations, advocacy groups, and so on. And in each case, we expect them to work with people in these organizations to frame a research question that these groups will find significant in relation to their own needs. The internship starts as close to September as possible, although it can be later in the first semester, so that during the summer before a person starts the program, we start trying to identify possible placements. The internships are not a sort of a set list from which students choose. Rather, they are, the idea is to have them set up in relation to, again, your particular career commitments. We expect you to put in about 8 hours of donated time a week in ways that helps you learn about the organization and the people it serves, but also in a way that meets the needs of that organization. In many ways, we view research as an act of service aimed at meeting the needs of the people who agree to participate in it. And so that starts with the service learning internship. We also require intensive summer field work between the first and second years so that you get experience during the first year, both in a field site, through your internship, designing a study, putting it through the ethics review panel at the medical school. It's the same one that senior researchers go through, and then doing field work and writing a thesis then during your second year based on your field work. We also require students to do professional development workshops. So all in all, the program is designed to walk you through the entire study design, research, and write-up process in which you synthesize your own fieldwork and theory and so on. Now, people often ask what we look for, and we do not expect that you must have prior background in anthropology. If you do, that's fine. We really examine people's transcripts and letters of support and their statements and other experiences they've had for indications that it looks as though they'll thrive in the program. That all of these things add up to suggest that you have the capacity to do well. We don't tend to look as closely at the STEM grades that someone may have because those skills are not as relevant to the work that we train people to do. We do look more at previous humanities and social science grades. We look for whether someone has improved over the course of their undergraduate career. We look at the kind of topic you want to work on. If it is with, say, a topic or group that we know is not really present in the city of Boston, then it's more a matter of not being the right fit because we wouldn't be able to identify groups or people with whom you could work. We look at whether or not you've done other volunteering or interning in settings that represent cultures different from your own. That is not a requirement, but it's just one of the things we look at. I think more than anything else, and this is less tangible and definable, but we look for people who show that they rather like to color outside the lines, who are interested in bringing things together in somewhat innovative ways, but that are also feasible. And I realize that's a little vague, but it is one of the things we look at and look for. Okay. The applications open, the date opens on September 1st. Now for this coming fall, that means that they opened this last September. They continue on a rolling basis through August 1st, although generally speaking, it is, unless you're local, we would not recommend trying to get an application in by August 1st. It just is not enough of a turnaround time for evaluation, for getting all of the documentation. And there is a point later in August when the division closes the admissions process. We start reviewing applications as they come in. It is on a rolling basis. So if a cohort were to fill and you applied and there were no spaces, you might be put on a wait list, but we couldn't guarantee that you could start in the fall. International students must plan on submitting their completed applications no later than May 1st, just because, and especially now with travel restrictions, it is otherwise not feasible to get everything reviewed and in place in time to come and settle in. We are a Massachusetts residency-based program that does not, for people who are already Massachusetts residents, that gives you no advantage in terms of tuition, unfortunately, but you must be living here. We do not have an online version of the program. You will need 3 letters of recommendation. 2 ideally are from faculty, but if you graduated a while ago and you feel that there's somebody else who really knows you well and can speak to your strengths and abilities, that's fine. We'll need academic transcripts from any other school programs you've gone to. For the purposes of the application, you can submit an unofficial transcript, but if you're accepted to the program, by the time you go through registration in the fall of your first semester, the school expects you to provide official transcripts. You need a personal statement of at least 500 words. And in that, what we suggest is talk about what background experiences and preparation have led you to apply to this program, and perhaps in one way or another you feel they've prepared for it. Lay out what you want to do with the degree and what you hope to focus in on. Does not mean you have to have a well-defined research question, but as far as our figuring out whether we're the right fit for you and vice versa, saying that you want to work within a particular setting or with a particular group or so on helps us. And if you have a sense of a focus, please talk about that as well. It's important to discuss why this program in particular. And it matters to be as precise as you can. It's always nice to hear that Boston University or the School of Medicine are great places, but that doesn't necessarily tell us what about this program you feel is most pertinent to the training you want to go on and do. If you've had previous research experience or activities or belong to any organizations, be sure to tell us about that. And you'll need a writing sample. That can be a paper you've written for a course. It can be something you've written for another purpose. The most important thing is that you feel that it represents your writing at its best, and that someone reading it really gets a sense of you and something about who you are. And if you want to have a conversation with me or with one of the other sort of core faculty, we are certainly willing to do that either in person or through Skype or Hangouts or something of the kind. Now, the current tuition is, for this current academic year, is $54,720, and full-time tuition is counted as 12 to 18 credits. By next year, it will be closer to, I believe, 57. And in addition, you have fees, room and board, and supplies. We are painfully aware of just how expensive that is. Tuition per se is something over which we have no control. The one thing we can do is give you a tuition cut. And so I'll come back to that in just a minute. The program is loan-based, so students have to apply for financial aid through FAFSA, which is a sort of form you fill out explaining your financial resources. Every student, at least so far, is guaranteed $20,000 a year in federal loans, with the balance generally made up by private loans. On our website, you will see that there is a link under the admissions section on funding your program. What we have gathered there are as many links to as many external funding sources as we have been able to identify, and we strongly encourage people to apply for those scholarships and fellowships. If you are admitted to the program and you decide to apply for one of those programs, you'll want to be sure to be checking deadlines because they come up often in the spring. And if you miss them, you would be waiting until the following year to see if you were eligible for them. Doesn't mean you couldn't start the program. It just means you wouldn't have access to those resources. That said, we do provide a tuition reduction scholarship. And the way we have calculated this is to be about 1/4 of the total tuition. In other words, about the cost of one semester. That means that for a 4-semester program, as far as tuition goes, you end up paying for about 3 semesters, which puts it closer to the tuition of some of the masters in public health and so on. We wish we could reduce it more. Unfortunately, we cannot, but it's to try to make it feel a little more possible to come. Most of the students in the program have done so, have entered the program with this combination of loans. Many of them work part-time. We have added a section to the Funding Your Program page talking about the different ways we try to make this investment in your career worthwhile. We take our responsibility very seriously to prepare you for the next steps of your career. And as we say sometimes to students, you have to pay too much money and do too much work for it not to pay off for you. And that's why we take such pride in virtually all of our students getting jobs within such a short time of graduating. This is an example of what the curriculum looks like. During the first year, you have required year-long theory seminar and a year-long 2-part seminar in research methods and design. Plus you do your service learning internship and you have slots for 4 electives. During the summer, you do your intensive field work, and then in the second year, you do a course on reading ethnography, which is to help you understand anthropological writing as a sort of way of going about telling a story. And you work on writing your thesis, and you have slots for 3 electives. Core faculty teach all of the required seminars. That means you see all of us generally at least once a week. We also teach some of the electives, at least the ones that are offered within the program. It means you have pretty steady and regular connection with whoever has been designated as your advisor, as well as other program faculty. And your advisor is selected based on whichever of the faculty in the program we feel has the closest connection with your specific interests. Our graduates go on and enter into different branches of research leadership, healthcare research, project and program management, healthcare consulting, health promotion leadership, healthcare management, and in a few cases, digital research and social media marketing. It's worth noting as well, we've been tracking what graduates do as a first job and then second job and so on, because we now have been doing this for about 10 years. And what we see is that people start out with, say, a position that's commensurate with their training, and within a year or 2 they move up, and then they may move up again, or in some cases they may decide now that they want to take that work experience and go into doctoral level training. We've tried to document some of that on the website under sort of what our graduates do, and I invite you to look there. We also, in order for you to see the kinds of research students have done, have a page under sort of alumni about what people wrote their theses about and where they are now. We've provided their LinkedIn pages, so if you see someone has written a thesis that you think is really interesting and you want to be in touch with them, you can go through their LinkedIn connection and make your own connection with them. It's also a good way, if you want to connect with previous students, graduates, and so on, to ask them about their experience of the program. You can do it that way as well. This is just a list of some of the kinds of things students have done. Again, that's on our website, so I won't go on into it in detail. And as far as where you send documents, you send them to the admissions office. As you will have seen if you've looked at the application form, everything is uploaded, but if you need to send something to the school, this is the information. The program administrator is Nancy Ferrer-Tikowska, and that is her email address. You can also write to me, Linda Barnes, and why there is now an S after my email address, I have no idea, but you leave that part out. You're very welcome to write to me with further questions, and that is the end of the slide, so I'll put that slide back.